The new circumstances of a healthcare professional's life and work today in a time of pandemic have stimulated new emotions and situations that need to be recognized and identified, so we can all take steps to preserve our mental health and emotional stability. Mental health is one of the most important determinants of health, and although the World Health Organization has drawn up a global plan for 2023 with a focus on maintaining mental health in general, specific guidelines for healthcare professionals in a pandemic situation have just been released these days. Let's take a brief look at the top advice and recommendations together. First, it is normal and okay to feel bad in such circumstances, as well as to feel good, just okay. In both cases, we should definitely not ignore our emotions or feel guilty because of them, judging whether such emotions are acceptable or not. Emotions should be named and communicated to those who live and work with us for better understanding and healthy relationships. Psychologists, therefore, will advise us to express ourselves in sentences such as, "I'm tired," "I feel fear and insecurity," "I'm afraid for the health of my children," "I cannot see the point," "I'm not sure what to do," or "I'm fine, I did have a good rest and sleep," "I am strong, I can manage it," "I'm happy with this day," "I'm calm and available for whatever it takes." It's also normal and acceptable for our emotions to change as circumstances are changing. So it would not be a good idea to take on the permanent role of a victim or superhero as the representation of our identity, but to allow ourselves and others to change our moods and attitudes. If we can still sense that we are in a phase of panic or fear, it's good to be aware of things that we can as well as the things we cannot influence in order to allow our life to move on. For example, we cannot influence the length of this pandemic, the consequences of illness in serious cases, the behavior and emotions of other people, or the measures determined by the national authorities. But we can definitely influence our own behaviors, attitudes, priorities, and how do we use our time, take care of ourselves and those who live and work with us, and help those who need the help the most. It is a good idea to make a plan for all the things that we want and can do for our family, work, education, and maybe hobbies that we might have neglected in the past. It is not recommended to constantly focus on this new situation and neglect other aspects of life. Of course, we should keep track of the news and be informed, but we must not be fed on bad forecasts and stress ourselves and others with unverified information. We should try better to filter the content of the news, then rationalize, learn, and verify to be able to communicate well and form our own views, which will strengthen our self-confidence. It is worth thinking about our physical, emotional, psychological, and spiritual needs, and to care about the balance. Here we are talking about sleep hygiene, healthy nutrition, physical activity, and things that will usually calm us down, and things that we usually enjoy. Listening to music, reading a good book, praying, meditating, or spending some time in the garden or nature will strengthen our emotional stability. Social contacts will greatly contribute to this. Conversation with friends, relatives, colleagues, playing with children and pets. Alcohol, smoking, excessive consumption of food, and taking medicines not prescribed by a doctor should be avoided, so as not to compromise and endanger our health. Humor. In this new situation, our perception of what is funny and what is not could significantly change. So let's not be too judgmental about what is appropriate or not, because different people will have different perceptions. We should not waste our energy discussing these things with our patients. Let's avoid to judge other people's behavior, criticism, gossip, and spreading the bad atmosphere. Rather, let's prefer nice praise, small surprises, services that can help those in greater needs than us, and let us be available for any type of help. It is good to engage in volunteer work in aspects of life where our knowledge, experience, and skills can make life easier for others. However, let's be aware that depressive episodes can happen to us as well, implying that feeling that we are not important to anyone or needed by anyone. We could suffer from a decrease of appetite or insomnia, anxiety and insecurity, even panic attacks that can manifest with rapid heartbeat, cold sweating, shallow breathing and unexpected crying. This can especially occur if, due to the nature of our work, we need to stay in self-isolation or in quarantine if we are infected. Let's talk about it with our loved ones and try to help ourselves with phytotherapy, psychotherapy. Maybe we can join groups of our colleagues who are facing similar problems. By no means we should not condemn or stigmatize colleagues who have become ill or have experienced any mental health problems. If we regularly take pharmacotherapy for any form of psychosis, depression, anxiety, insomnia, etc., we have to pay attention to our adherence and any necessary adjustments to the new situation. Colleagues, dear fellow pharmacists, let us guard our mental health and healthy emotions. Let's try to enter the zone of learning, discovery and growth, and leave the zone of fear and panic. With the help of emotional intelligence, we can become aware of our emotions, initiate self-discipline, and work on self-motivation. These mental health components will then become a part of our personal and professional integrity, and we will be able to help ourselves and others. All will be well if we are well. Please do not accept anything less than that. Ask well and answer well the question, and how are you, my dear pharmacist? Good luck.